few hours in thanking our sponsors. And so I'd first like to thank RIPI, the Race Inequality Policy Initiative happening here at Wake Forest University. I'd also like to thank Action for Equity and Parent Power, who are heavily featured in the last panel, and also the Forsyth Futures group. And so before we kick off the rest of our events here, I'm going to turn it over briefly to Adam Hill from Forsyth Futures to share a little bit about the work that they're doing, which is very related to the COVID pandemic.
Yeah, thanks, Brad, and good evening, everyone. So just wanted to take a minute to share a resource that Forsyth Futures has recently put together. As Brad said, I'm Adam Hill. I'm Executive Director of Forsyth Futures. If you aren't familiar with us, we're a nonprofit in Winston-Salem that provides local data to help inform decision-making in the community. So I wanted to just really quickly highlight an interactive web report that we've recently put out that is focused on the local impact of COVID-19. So in this report, we are including a dashboard of economic indicators that will help tell us really in real time how the local economy is changing. So this can help give us an indication of when things are starting to get better in our community. It includes data on things like unemployment and jobs by different sectors in the county. The other primary data that we're including is highlighting the number of residents who are potentially most vulnerable to the economic shocks of this COVID-19 crisis. And just to highlight one really kind of top level finding from the report, which unfortunately is potentially unsurprising, is we found that people of color in our community are particularly vulnerable to the economic shocks of this crisis. And so if you want to see the other kind of key findings of what we pulled together, you know, you can go to that URL below and also drop it in the chat box. But thank you for letting me kind of share this report and you know, letting you know what it's about.
Wonderful. Yeah, thank you, Adam, for being here. And thanks again to Forsyth Futures for sponsoring this event tonight and this conversation as we dive into COVID-19, both at some of the larger level indicators that Adam mentioned, and also some of the work that our students have done. So that transitions us nicely into our first student presentation. We're going to hear from Meilyn Norman, who will share about a project she did with mathematical modeling here in Forsyth County. So Meilyn, you can take it away.
All right, can everyone hear me? All right, hopefully. Okay, hi everyone. My name is Meilyn Norman, and this summer I worked with Dr. Sarah Mason. I'm an anthropology and math double major here at Wake, and I'm a sophomore from Raleigh, North Carolina. Our project attempted to model the spread of coronavirus within the Winston-Salem community. So a brief introduction of what is this project. The goal of the project was to use advanced mathematical modeling techniques in order to represent real-life COVID data. We focused on graph theory, specifically on the Ford-Fulkerson algorithm and the Markov chain method. So a brief introduction to each. In the Ford-Fulkerson method, we looked at the concept of flow as interaction between zip codes. Using the Markov chain method, we attempted to model current data in order to predict long-term outcomes and look at case spread patterns. And finally, in data visualization, we presented information in a simple, accurate way so that individuals could individually interpret the results. In order to look at Winston-Salem data, we used zip codes to break the area down into smaller regions. We investigated interactions over time by looking at the percentage of population that had tested positive and the number of cases per zip code. Here's our network based on the real-life layout of zip codes in Winston-Salem. We started with the downtown zip code, which is 27101, and then we added all of the zip codes that touched them. Then the points were connected with an edge if they were touching on the map, and we did not include the smaller zip codes for the hospital or Wake Forest University for our data. So our first method was the Ford-Fulkerson algorithm. The overall goal was to use the concept of flow to represent interactions between various zip codes. By evaluating the importance of different interactions, we can make judgments about how to prevent the spread of cases after a set period of time. So there were some problems with this model, namely the rapid growth of the virus within the area meant that the structure of the model didn't really work. The model's main conclusion was to cut the virus off at the source, which is not possible here because we can't prevent the virus from coming into the area. Our second method, Markov chains, attempted to model the current pattern of case spread between zip codes and then use that information to make predictions about the future. The largest problem with this model is that we worked with a single variable, which was the probability that a new case is infected within the same zip code as the original. This meant that the model was too generalized to represent the intricacies of Winston-Salem, and we had to disregard many important factors that would impact spread patterns. All of our models concluded that the central point, 27101, should have the largest number of cases, which is actually not what happened in real life. In real life, the downtown zip code had comparatively few cases compared to other areas in terms of population and generally. The last part of our project was less about models and more about accurately representing data points so that individuals can understand them. This is similar to modeling because both attempt to make data more accessible and able to be worked with. And here's one example of a graph made with the COVID data we were working. The graph shows the growth in the percentage of population that is infected over time. And as you can see, zip codes with a higher population of people of color had a very dramatic spike in cases in comparison to others. You can visually see the disparity and unequal spread here. The bottommost red line is representative of 27101, which is demographically and economically different from many other communities of color in Winston, which could potentially account for its lower number of cases over time. So why is it so hard to model real life scenarios? So during our project, we had three major challenges. First is that we had limited resources. This included time, since we only had about 6 weeks to conceptualize and implement our model. This also included the data available to study. COVID-19 is a new disease, and its rapid spread made long-term data unavailable. We also didn't have data at a more local level than zip codes, which are kind of too large to be generalized well. We also had difficulty with the number of variables we could use. More variables would have created mathematical challenges and would have been incredibly difficult to analyze. However, a smaller number of variables made it hard to model the diversity and inequality within the Winston-Salem community. It failed to account for socioeconomic factors that had a huge role in case spread and interaction. Finally, it was hard to predict a model success at the outset of the project. We used other students' research as the basis for our models. However, it was hard to predict whether the differences in COVID data versus the data they worked with would provide interesting insight into the disease specifically, or whether it would stop the model from being effective. There is a ton of opportunity to continue our efforts to model COVID-19. One way is to study a larger area for more data points. This modeling could potentially be expanded to the county, state, or national level. Another way is to increase the number of variables so that factors such as socioeconomic status could also be accounted for. And to conclude, at the beginning of working on a project, it's easy to think that models are easy to make and conceptualize, but when you're actually working with something complicated that you need to model, you have to make decisions and prioritize certain aspects. I learned a lot about the decisions that researchers have to make and the challenges that present themselves in the process. Nevertheless, models are still very important to representing data and drawing conclusions. The questions we're asking now require complex and thoughtful consideration in order to solve. However, good design and further study can produce actionable change within our community. Thank you all so much for your time and attention.
Wonderful. Thank you so much, Meilyn. Really great to hear about your work as you think about modeling this virus here in Winston-Salem. Next, I'm going to turn it over to Ishani, who's going to share about a localized look at nonprofit funding that she was able to conduct this summer.
Hi, everyone. My name is Ishani. Can you guys hear me all right? My sound is a little bit compromised today. Be good. Okay, well, thank you all for having me. My name is Ishani again, and my project this summer examined the resource and financial needs of nonprofits in Winston-Salem, and then best practices moving forward into this pandemic, because we know it'll probably last for a little bit while longer. I did my research under the supervision of Dr. Alessandra von Berg, and she was incredibly helpful and supportive through the whole process, so thank you, Alessandra, for all that. So next slide. So first, I'm going to share a bit an overview of COVID in Winston-Salem. So as we know, the pandemic has had significant effects on economies all over the country, and the virus has been disproportionately infecting communities of color. And in Forsyth County alone, as of yesterday, we have had 6,457 positive cases and 82 deaths due to the virus. The most notable trend that I found were that more than half of the cases were from the Latinx community, and even though this demographic only constitutes about 13% of the population. And then overall, I found that nonprofits who serve these communities have tried to adapt to the shutdowns and CDC guidelines and make their programming work. So for my project, I interviewed nonprofit leaders, community professionals, and representatives from United Way of Forsyth County and KB Reynolds Charitable Trust to gather my data. And a little bit of background on the two nonprofits that I focused on. The first one was Every Campus a Refuge, and this is an organization that started in Guilford College in 2016 as a response to the Syrian refugee crisis as it was getting worse. And there are multiple branches outside of Guilford College, including at Wake. And they mostly help house refugee families, help them with job mentoring, tutoring, and medical expenses. And students, volunteers in the refugee task force are like the drivers behind running eCar. And my second organization was Latino Community Services, and this is a family and educational service nonprofit, and they mostly serve the Latinx community on the east and south sides of Winston-Salem. So changes since March, I divided my research into how each nonprofit really changed since the pandemic began. And the biggest change that I saw was the increase in demand overall. It was primarily for financial assistance for rent and utilities, medical expenses, and continuing studies, and also for tutoring and childcare services, which were abruptly stopped that were originally in-person programs due to the pandemic. And there's also been a significant decline in volunteers for these organizations because obviously due to social distancing, we can't have in-person help. And then also since the university shut down in March, a lot of student volunteers were not readily available. Also, for changes this March, expenses and grants, both organizations made use of donations and campaign fundraisers, and LCS has benefited from grants from KB Reynolds Trust and United Way, and eCar has been mostly relying on donations and fundraisers, and they did not apply for grants. But expenses vary between the organizations, but they've managed to still keep their programming and help the people that they serve. As for the giving foundations, they've been incredibly generous in helping these organizations stay afloat and keep their programming to serve their communities. And the two ones I focused on were United Way of Forsyth County and KB Reynolds Charitable Trust, but the Winston-Salem Foundation and many other organizations help these nonprofits as well. So best practices moving forward. I found that increasing digital programming and education and family help was the main thing that organizations struggled with and how to adapt quickly to, because we didn't have a tutoring program readily available that was online. So that was a big hurdle that LCS especially had to adapt to. We have to continue supporting low-income communities and communities of color, and collaboration with other organizations and learning from them and creating new ones to meet need. One that I found was Neighbors to Neighbors, which is a small informal mutual aid group that started in March as a response to the pandemic. And they're modeled similar to eCar in the sense that friends of friends help with resources and donate monies to help the people that they serve. And it's mostly undocumented families and refugee families. And they're fairly new, so it's still pretty small and informal, but it's a good example of new solutions to meet the needs. And of course, applying for more emergency grants and more donors and learning from other nonprofits is the biggest thing that I found with my research. And as we know, it's very challenging to anticipate a pandemic and make the necessary changes to accommodate the new needs of the community. But many of the disparities that came to light during my research were issues that persisted in Winston and the United States for a very long time. And I just think, making good use of adapted programming is the best way to move forward with this. So thank you for your time.
Wonderful. Thank you so much, Ishani. All right, I'm going to turn it over now to our last student speaker, Natalie Graham, who's going to talk more broadly about some of the COVID funding that she was able to look into here in Winston-Salem. So take it away, Natalie.
Hi everyone, I'm Natalie. Today I'll be presenting on COVID-19 and nonprofit funding in Winston-Salem. I worked on this project under Brad's supervision, so once again, thank you for the opportunity. For a bit of background on the resources available in Forsyth County in response to COVID-19, they received $6.4 million of the $4 billion in direct CARES Act funding allocated to North Carolina to aid municipalities during the pandemic. In comparison to our neighbor Guilford County that received $90 million, this doesn't seem like a lot of money. In fact, Forsyth County received substantially less CARES Act funding than other metro areas in the state, even though we're one of the bigger counties. In addition to this funding, over $4 million in grants was awarded in Winston-Salem by the COVID-19 Response Fund. As we know, the city and major funding organizations awarded these grants to nonprofits who directly support their clients. And this fund, along with outside grants and an influx in private donations, helps nonprofits and city programs adapt their services in response to the pandemic. So this kind of brings me to my research question of how do nonprofit organizations and funding organizations in Winston-Salem intersect to meet the needs of the community during global pandemic? And throughout this project, I focused specifically on the 27105 zip code as it is vulnerable due to pre-existing challenges, for example, barriers to employment, a digital divide, and residential segregation. And through interviews with local nonprofit organizations and literature review, I was able to learn a lot about how COVID-19 response funding was spent and how organizations collaborated during this critical time. So COVID-19 amplifies the aforementioned challenges and also increases community need. For example, since March, people have seen empty shelves at the grocery store, and wavering stock market, and uncertainty in their job security. However, with over 400 nonprofit organizations in Winston-Salem and the addition of millions of dollars in grants, organizations in different sectors are able to establish collaborations to best serve their neighborhoods. For example, in one of the interviews I had with the executive director of an economic empowerment nonprofit, I learned that they collaborated with Wake Forest University and another nonprofit in the food industry to provide PPE and paper products for all of their clients. Through these interviews and surveys, I learned that healthy food and meal provisions were the most common spending priority in response to COVID-19. For example, one nonprofit that is Food First organization reported spending an additional $10,000 per month in order to double their meal production. And from the COVID-19 Response Fund alone, over $1.5 million in grants was awarded to nonprofits and faith-based organizations in food and health. Food insecurity is just one example of an existing problem in Winston-Salem that was amplified by the pandemic. Additionally, people were laid off at the beginning of quarantine. So housing and eviction crisis is a growing challenge, and this possibility is dangerous considering that the safest place to be in a pandemic is at home. From the Response Fund, about $2 million was granted to economic empowerment and emergency response organizations, and a lot of these funds were allocated towards rent assistance, utility assistance, and shelter for people who are homeless. Another trend in this data is that COVID-19 funding in 27105 was relatively the same proportion as funding for programs in the zip code in a normal budget, and the needs were also consistent with those throughout the entire city, but potentially more intense because of social economic disparities faced here. This trend can be seen in these images, which highlight the grant expenditure priorities by nonprofit organizations in Winston-Salem. So words that appear in a larger font were mentioned more in the interviews and surveys that I conducted and in public grant information. So from these images, it's clear that food is an important priority, and PPE, financial assistance, and cleaning materials were also common needs reported by these organizations. The timeline of my information for my project goes through the end of June. So something to consider with that is that during that time, people were receiving more assistance from the government, and a lot of these programs ended at the end of July, meaning that now people may rely on more nonprofit services. And another thought is that the effects of COVID are not disappearing, and nonprofits must find more sustainable solutions as opposed to the immediate relief. And one way that organizations are doing this that I learned through my interviews is that one organization, in addition to providing immediate relief, is encouraging their clients to complete the census to receive more federal funding for rebuilding after COVID. Additionally, there was another round of COVID-19 funding distributed in August through the COVID-19 Relief Fund. I really enjoyed working on this project, so thank you so much for your time.
Wonderful. Thank you so much, Natalie. I am going to very quickly hand it off to Amy Lytle. She is the Executive Director of HandsOn Northwest, and she's going to be the moderator for our panel tonight, which will be responding to and building upon the presentations that you just heard from our students. So Amy, you can take it away.
Thank you so much, Brad. I really appreciate you being here. And Natalie's presentation is a great segue into our discussion. I'm thrilled to be here today with some of those core funders in Winston-Salem: Shenell Thompson from the KP Reynolds Charitable Trust, Sandra Fishel-Booth from the Winston-Salem Foundation, Charmaine, and I'm going to, Angino, I'm sorry, it's just stumbled over your last name.
Angino. Yeah.
Angino from the United Way of Forsyth County, and even Raleigh from the city. And I would like to just start by having you all just introduce yourselves a little bit more about sort of the role that your organization has played in terms of COVID-19 response funding specifically, or how you've sort of shifted your funding priorities in light of the pandemic. And I know Sandra was the primary program officer for the main community-wide emergency response fund. I'm going to let her go into a little more details, but we'll start with Shenell first, and then we'll end with Sandra.
Good evening. Again, my name is Shenell Thompson, and I'm the Senior Program Officer of Local Impact at KP Reynolds Charitable Trust, and glad to be here with some of my friends tonight. I think with KBR, we were able to invest about $3.2 million in immediate flexible funding for the COVID response in Forsyth County and throughout North Carolina, and I'm happy to share more information throughout the night of some of the ways that we invested our funds.
That's great. Charmaine?
Hi, I'm Charmaine Angino. I'm the Senior Director over our community-wide investments here in Forsyth County. We invest about $5.4 million on an annual basis, and I'll talk a little more about how we pivoted during the pandemic.
Evan?
Hi, good evening. My name is Evan Raleigh. I am one of the Assistant City Managers for the City of Winston-Salem. And the city is kind of an annual funder of many nonprofits in our community, but specifically as it related to COVID-19, we, as you heard from Natalie, we contributed roughly $1 million to the community-wide COVID-19 response fund. And we also kind of served as a pass-through for several $1 million worth of federal grant money that came to our community as a result of the CARES Act. And again, we can now, sure, I'll touch on some of those funding streams as this conversation goes forward. Good to be with you.
Sandra?
Sandra Fishel-Booth, and I'm with the Winston-Salem Foundation. I'm a program officer in the inclusive economy. And the Winston-Salem Foundation, in addition to the United Way, administered the COVID-19 response fund for Forsyth County. However, I just want to mention that that fund was very much a collaborative community effort, and it comprised public and private funders as well as community partners.
That's great. Anyone want to speak a little bit more sort of how you feel that that relief funding kind of went? As you said, there were 2 rounds. As Natalie mentioned, there was a round sort of earlier on in the pandemic, a round that just sort of closed up in August. Sort of where you feel the impact of that funding was.
Well, I'm happy to start off. I think that, you know, we really wanted to make sure that this fund was supporting those organizations that really are providing critical support to local nonprofits that were assisting with the immediate needs of the economically vulnerable populations that were impacted by COVID-19. And so for that reason, we chose to disperse funds as operating grants so that organizations would have the greatest amount of flexibility for them to be able to really respond. And in April, during the first phase, we made 52 grants totaling 2.5 million, a little over 2.5 million. And we were really intentional to make those grants to both larger human service agencies as well as smaller faith and community-based organizations who are all working to meet those immediate needs. And then in phase 2, we also made a proactive grant of $121,000 to specifically help Latinx households because we saw about the disproportionate level of infection for those individuals. And so those grants were to help meet financial needs that arose from testing positive to COVID-19. And now there is a final phase, which we are planning to launch in September.
Well, that's great. That's great news. I'm sure it will be needed because I think the whole thing is that the pandemic has lasted longer than any of us. I remember those early calls about the emergency response fund in early March, and the idea was immediate, short term, let's get through this crisis. And I think as it has lingered, the impacts are greater and more long lasting. Shenell or Charmaine, either of you want to chime in a little bit about sort of your kind of immediate funding response over the summer?
Yes, I can chime in. So we kept steady when the pandemic hit. We fund about 45 programs in community-wide, and then another 15 to 20 programs in East Winston, which is our place-based initiative. And so our goal was to do a lot of check-ins with those programs to see how they were doing. I don't think I've talked to as many EDs in 3 months' time as I did in the initial phase of the pandemic. And so we try to keep our funding steady and allowed flexibility on how they had to pivot in order to continue delivering services. Some of the after-school programming we were funding went to 11 hours a day versus just 3 hours a day in the evening. Many programs were pivoting to virtual services, whether it was mental behavioral health, financial counseling. Everybody was pivoting, just like in the world of work. Social services was pivoting to that as well. And then we also brought together our educational partners in like late May, early June, because there were so many issues that were still being discussed about how summer programming was going to take place, and so wanted to provide a forum for those partners to talk about, how they're going to get protective protocols and masks to the kids, and and just all those details that some small grassroots agencies might not have all the answers that bigger nonprofits would have, and so it was really just learning a lot and being able to keep those channels of communication open between all our partners.
Great.
Oh, and then just real quickly, just as a blurb, because I don't oversee the housing work, but we have 8 people at United Way that oversee, that is part of our Housing Matters. And so they worked with the city and the county and the health department in providing guidance to the local shelters here in our community. And they also looked to open the isolation site shelter in April for any individuals that were came down with COVID, as well as opening to a medically fragile shelter. So that all happened within a month to 2 month span of time.
Yeah, and those were luckily not as overwhelmed as that
Right.
was good news
Yeah.
about that. Is that the shelters were there and were needed, but were not overwhelmed as we feared as a community. Shenell, do you want?
Yeah, so initially in March, the trust was able to provide $1.5 million. Within 24 hours, we were able to work really closely with our trustee at Wells Fargo. So we were able to provide $500,000 to the COVID response in Forsyth County, and also provided $1 million to North Carolina Healthcare Association Foundation for statewide coronavirus efforts. And then in May, we provided an additional $1.2 million to help residents and communities address some of the challenges that they were facing. And we're able to add in another $500,000 to the COVID response fund late in August. And I think one of the things that we really were intentional about in that May funding was that we took a look at the nonprofit organizations and grantees that we had supported in the past. We wanted to make sure, especially those who were being led by people of color and serving people of color, that we were able to help provide them with some general operating support, which would help them during this time to, be able to focus on providing needs and not focusing on programmatic grants.
That's great. 24 hours is really an amazing turnaround time. And that's very impressive, especially because you are having to work through a trustee that's not necessarily local, not necessarily a group that you control. So thank you so much for those thoughts. And it's good. One of the things that's good to know that there is going to be this last bit of funding kind of going into the fall, because I think one of the things as the pandemic has lasted, that many, if not most of nonprofits, typical kind of business models, sustainability plans, have just become less viable in this environment for whatever reasons. And based on these realities, how do you really see the funding landscape kind of playing out over the next 6 to 12 months, assuming that these changes are going to still be with us for at least maybe another year, according to Dr. O at Wake Forest? Charmaine, do you want to start this one?
Unmute myself. Yeah, it's I would say right now we are still in discussion at United Way. We are in between. We are about to launch a new funding cycle that was scheduled to start. Information was supposed to go out in the community this summer. That got all postponed. I'm hoping that it'll go out in October, November. And so we're having to make some decisions. I think it is going to affect how we fund. Education-wise right now, there's so much up in the air about remote learning, about the virtual learning, whether they're going to be in classes, and that has really affected all the programs that we fund in that educational arena. So I think we're gonna not put the brakes, but we're gonna look to see what happens in the spring. We want to continue funding what we're funding. We are getting a lot of requests from the community for those remote learning centers to fund those. And so we're trying to decide what is going to be the best approach. We always knew going into the fall that new things were going to bubble up. We also hear from our partners that, that they're afraid that we're going to have a real increase with all these moratoriums being ended, that we're going to have a lot of people needing some support. There's going to be a lot of crisis out there. And so we're trying to pivot and see what comes up. We are still going to be launching an investment process again in the fall around economic mobility. I do think it's probably the right time to do it, and it wouldn't start again until next July. Yeah, we're trying to be flexible, but I think it is going to change, and a lot of stuff we just can't foresee for now.
one of the things that I've learned through this pandemic is that it's almost impossible to plan during a pandemic. It's very hard to kind of try to foretell the future when next week something could change, right? And I think the situation is a good example of that. Sandra, Shenell, your thoughts about sort of the changing landscape going forward?
Well, I'll just kick it off and say that, I think that there's going to definitely be a really huge need for more flexible funding. I think operational support is going to be needed, now more than ever. And I think that, through some of the foundation's work around our capacity building programming, we'll probably see a lot of organizations coming in and needing help from consultants for business, how to restructure their organizations to have more effective business models, and also new ways of being really innovative through virtual fundraising, since we know gathering in person is just not going to be a possibility anytime, in the near future. I also would say that, the pandemic is going to definitely impact both of our focal areas around equity and education. We're already seeing some of the new challenges that are arising from remote learning, and equity comes into play with all of that. So we'll be shifting and looking to see the opportunities where we can leverage both with equity and education and also with building an inclusive economy, getting people back to work, but looking at the issue of transportation as well as the racial wealth gap.
As a capacity building organization, it's good to hear you say that, but I think that that whole thing around kind of looking at business models, looking at restructuring, because those large galas, those large events, you can move them online, but are they as effective as they were, 6 or 12 months ago? Shenell, thoughts that you have about the future landscape?
Yeah, so I think some of the things we're trying to look at is ways that we can communicate with our grantees and partners and understand what's needed most right now in the community and how we can support those that are working with our most economically vulnerable communities. We're also looking to see how we can partner with those we work with every day to address the crisis, collaborating with our partners about what types of local funding pools may be available in Forsyth County and across North Carolina. And then I think finally just recognizing that we have to be more flexible with the way we do our funding. In this last funding cycle, we have been given extensions to our grantees so that they can focus on their most immediate needs and not hold them to programmatic grants that they had in the past, helping them to be able to move their programs from in-person to virtual, understanding that takes more support, they need more time to get things in place. But I think most importantly, just listening and being able to respond as we see this thing continue to grow.
Great thoughts, good points. So Evan, I've got a sort of a slightly different version of the question for you. As Natalie pointed out, Guilford County was awarded $90 million in additional direct funds from the Treasury because they made an relatively arbitrary population cutoff that Forsyth County didn't make. And as you mentioned in your introduction, a lot of these private nonprofits, that regular ongoing funding from city and county government is a key part of that sustainability, that business model. Sort of how does those lack of funds sort of impact how you see those impacting nonprofits going forward?
Yeah, I kind of cringe every time I hear that figure. Our neighbors to the east got, $90 million of direct funding. For those that might aren't familiar with kind of what happened as a part of the Coronavirus Relief Act, municipalities that were over 500,000 population got basically direct assistance from the federal government. And those that were under that threshold essentially got nothing, at least in the earlier packages. So, communities in North Carolina, that meant that there were 3 municipalities that got that money. That was Wake County, Charlotte, and Guilford County. And they got substantial sums of money. Guilford County got $90 million. Wake County got $193 million. Charlotte got something close to $200 million bucks, and we got nothing, which was incredibly difficult pill for us to swallow. And so that has very real effects. those communities, you talk about Guilford County, one of the things that they were immediately able to do with the funding that they received was to establish a grant assistance program to local nonprofits. I think they were providing, they set aside several million of that 90 million to provide $50,000 one-time grants to local nonprofits. And at least in the early stages, had it not been for the community collaboration, under the leadership of the city, the United Way, the Winston-Salem Foundation, KBR, all of them coming together to establish this fund, I don't know what our nonprofits would have been able to do. Frankly, I know a lot of them would have been challenged. Fortunately, there has been some level of additional assistance that has come in subsequent packages. Essentially, what happened to the other 97 counties in the state that didn't get direct funding from the federal government, the states, we basically were left to receive our allocations from the state. The state got $7.6 billion as part of the CARES Act. Of the $7.6 billion, they allocated $300 million to be divided up among all 97 counties. And we got, Forsyth County got $13.9 million, and the city of Winston-Salem ended up getting about 2.6. So, you think about 13.9 versus 90, that's a big discrepancy for two counties that are very similarly situated from a population perspective, from a needs perspective, from a demographic perspective. And so, it's difficult. We continue to hold out hope that there will be, that there's legislation on the horizon that may rectify what we see. And you use the word arbitrary. I think that's a perfect label for it. That cutoff that was established for communities that received huge amounts and those that received essentially nothing. We've been working very closely with our federal advocate to bring that issue to our state senators, to our congressional delegation, frankly, to anybody that will listen to us in our plea.
You've got a story to tell and you want to share it. Absolutely.
Yeah. So, if anybody's listening out there, please, contact your congressman. Let them know that, it's a little unfortunate, unfair that Forsyth County was left out so dramatically as part of the first act. But so we're working hard to rectify it. Those hopes got dealt a little bit of a tough blow today. If anybody saw the news, the Senate was trying to pass a slimmed down version of another relief package, which failed to get out of the Senate. And so, it's looking a little gloomy, but we're not giving up the fight. And it's a message that we continue to sort of beat the drum on, that, our community is hurting much like all these others. And many of those communities that got huge hundreds of millions of dollars were frankly communities that were probably best positioned to weather this kind of storm. So inequity, certainly, but we continue to look for opportunities to help in any way we can and try to get some of those federal dollars back our way.
Yeah, I think that's a disparity that I don't think is widely known throughout Forsyth County, but I think it's going to impact both nonprofits and the people that we serve pretty directly, and I think those impacts will be felt more immediately than I think a lot of people realize. And great points, and thank you for sharing that kind of inside baseball perspective and how important it is for nonprofits and the people they serve to contact their elected representatives and do a little bit of that advocacy work as we work through this pandemic. My next question is really about sort of what you've learned kind of through this funding cycle, how responsive and how quickly things can happen if you really are intentional about it. And also thinking about the conversations both within the community and definitely within the nonprofit sector around racial justice and equity issues. Are there thinking around sort of how do you realign your funding processes, priorities to make sure to increase access and equity for those smaller grassroots nonprofits, especially those that are led by Black people, Latinx, and other people of color? Sandra, I know you've been doing some work around that. I think you actually mentioned this a little bit. Do you want to expand your thoughts?
Sure. Well, I would say that the foundation's focus on racial equity, it really encompasses even more than grant making. We're really, we're also centering on, including people with, the voices of people with lived experience, including them in decision-making processes for funding, to really shift that power dynamic. We're, also really trying to look at our own tracking in the future to see about, how we're making funds to, and how many funds, grants we're making to POC-led organizations. And, I would say, most recently we did make a grant, $75,000 to, the Greater Winston-Salem Inc. for their small business, their COVID-19 relief fund. And our funds were earmarked to provide, grants to businesses that are owned by people of color. And, we also tried to work and shape that process to make sure that people of color were also at the table to help design the requirements and the making of, grant decisions. And racial equity is also all throughout our strategic plan. It's really woven through all of our metrics now going forward. So it's not just about our grant making dollars, but about, are we using people of color as fund managers? And thinking about how we're going to reach more diverse donors, vendors. Those are all important. We're also making mission-aligned investments where we'll use the corpus of our endowments to invest in local government to benefit communities of color. And that money can only be accessed by POC-governed organizations. So I think that those are all really important pivots for the foundation. And we're just moving forward even more with like trust-based practices. Shenell spoke about it earlier about, lessening the grant requirements, not putting more of the onus on us to figure out the information that we need, not putting the organizations that we're speaking with through, having them jump through too many hoops. And so an example of that was the adaptation grants that we did earlier on for COVID-19, where we helped nonprofits just get funds that would help them to just quickly turn around and move their operations from, in office spaces to virtual. And so those types of funds, without any kind of reporting process whatsoever, is really what we're trying to do. And for people who are just interested in learning more about trust-based philanthropy, you can go to trustbasedphilanthropy.org, and there's a lot of really good information there.
I love that idea of trust-based philanthropy and how quickly those adaptation grants were turned around, and thinking about the idea of, let's not go back to the normal that was, like, can we go back to a better normal? Not just like this reality that we're living in, because none of this is normal, but can we get back to something that's better? Shenell, you want to say a little bit more about the way the trust is sort of thinking about these issues?
So I think it's very interesting that I started with the trust on May 1st, right in the middle of this pandemic. I started as the first virtual employee the trust has ever onboarded. And since that time, I think we've hired 4 people. And so even the way in which the trust has done business in the pandemic has changed how they do their work. And it's been very interesting for me to watch this process. But I think what the trust has done is that, we were already highlighting some of the inequities that are showing up with COVID. We were already in the middle of doing this work with our grant making. And so when we look at things like the higher infection rates for people of color, it really reminds us of how active we need to be supporting our community and thinking about how we do systems change work, and what we need to do to ensure that there is true health equity. And when we look at economic disparities in Forsyth County, we know that they were severe before COVID. And what COVID has done is just basically shine a real light on some of the deeply entrenched inequities that are in our community. And so we believe that working together, we can begin to make some change and shifts to the systems that need to happen in our state so that we can do well and improve, as Amy said, so that, this community, when we come out of COVID, is better than when we went in, but I think it does require us to have some really deep conversations. At the trust, there is a new role, our executive vice president. And one of the things that Stephanie will be doing is taking a look at the racial equity lens in which we do our work internally as well as externally, ensuring that, you know, the language that we use to speak, that we're bringing that lens. Sandra talked about some of those same things, you know, having a conversation about who are our vendors, how are we doing the work as we're hiring, what are our hiring practices. You know, do we, Dr. Gerald used this statement often, to be rather than to seem. So are we doing the work that we say that we're about? Does the racial equity statements that we're putting on our websites really speak to who we are, the values that we have within the trust? I'm excited to be a part of this organization, and in just the short time that I've been here, I really feel like we're committed to ensuring that Forsyth County and North Carolina is going to be better, but it really is about not being afraid to have those hard conversations about what it is we're seeing and how we start to disrupt some of those and dismantle some systems. You're muted, Amy.
I'm sorry. Charmaine or Evan, thoughts on this piece?
I will say that about 5 years ago, United Way began infusing equity into our work when we took about 25% of the funding that, you know, as all of you know, United Way has to raise their dollars every year. And so we took 25% of our investments and looked at a place-based model, which is resident-led. The residents determine the needs in their community, and it's based on a residence-based council of 13 neighborhoods, representing 13 neighborhoods in East Winston, and they decide where the money goes. And really the premise was it's all about doing with rather than for. And so we feel like we've got a basis now a base to start building even more work around that. And just like everyone said, you know, we've been doing a lot of important and hard conversations with our staff and our board, looking how we're going to be infusing equity even more in our funding decisions, our hiring decisions. And so it is being infused in kind of everything that we're doing. But we are, you know, we know that just like Shenell said, there's a lot of inequities that are even showing up even greater now because of the pandemic. And so I'm encouraged that, you know, we have a long way to go, but I think we have a pathway and realize that it is involving the community making these decisions. We don't want to do for, we want to do with. And so I think this model is really important in seeing how we can even grow it even larger in this community.
I think that's excellent points, and that whole doing with rather than doing for, I think, is such a key paradigm shift in this whole conversation. Evan, do you have any kind of final thoughts as we're right at 7 o'clock?
Well, you know, working in government, obviously with elected officials, this is clearly something that's always has and always will be top of mind for our elected officials in terms of how government is functioning, how we're conducting our business. Are we being inclusive in the way that we do things? Are we doing it in a representative way? You know, so I think that, you know, how that will translate into the way that we fund. I did mention that we do have an annual process where we award $2 million of grants. You know, I think looking at that process has probably been one that has been inclusive in a lot of ways. We've always had very, very diverse representation from folks, I would say, that are probably most impacted by funding decisions that are at the table. But I would say that there's probably always room for improvement in some shape, form, or fashion. And it's something I know that our elected officials are always, you know, challenging us to examine our processes and, you know, all across the organization to see and study how they may be improved to get to a more just place.
Great thoughts. As I said, you know, if you really want to work for systems change, you know, vote, volunteer, fill out your census. If anyone's on, I hope everyone on this call has filled out their census. That's a huge piece of, tomorrow is the 9/11 National Day of Service and Remembrance, and that's one of the pieces that we're encouraging folks to do is to fill out their census, make sure their neighbors have filled out their census. One of the best things that we can do to kind of work towards some equity and justice issues. Brad, I'm going to turn it back over to you. I don't know if we've got time for Q&A or not. I want to thank the panelists for your thoughtful responses and your participation.
Great, well, thank you so much. Yeah, we're going to wrap up here for the evening. Thank you again to the panel, to you, Amy, for guiding us through a really informative discussion. I think it perfectly encapsulated the conversation we've been having all afternoon and thinking about the ways that our community has rallied together around the fundraising need. And that has been an inspiring conversation to have, but it's also a sobering reality as we think about the challenges yet to come and the need to continue to come together as a community, both from a fundraising perspective, from a direct service perspective, and so grateful for those who are here tonight, learning more, thinking about ways to engage in this conversation. One last pitch for folks that are a part of the Wake Forest community specifically. We are starting a series of dialogues every 2 weeks on Thursday afternoon. So 2 weeks from today, we'll begin our first civic dialogue series here at the university to continue this conversation going amongst our campus community. So again, thank you so much for all of you who are here today with us. We're excited to begin this conversation and continue this work together. Have a great evening, and hopefully we'll see you again very soon.
Thank you all so much for the opportunity, and thank you so much to our panelists.